Hello class, today we're going to talk about chapter 17 in your book, which is vitamins, electrolytes, nutrition, antidotes, and bioterrorism. There's a lot of information to cover in this chapter. This might be a little bit long, so I apologize, but hopefully the next few weeks the lectures won't be quite so long. Our topics we're going to talk about today are vitamins, fluids, electrolytes, and acid-base balances, nutritional disorders, poisons and antidotes, emergency procedures, bioterrorism, complementary and alternative therapies. Our learning objectives include describing how the body uses vitamins and electrolytes, defining obesity, describe the prescription treatments for obesity, compare and contrast enteral and parenteral nutrition, including its purposes, ingredients, stability, and complications, list the antidotes used to treat occurrences of poisoning, understand the importance of the emergency cart, its supplies and its maintenance, and describe the role of the pharmacy technician in the event of a bioterrorist attack. Vitamins are organic substances that are necessary for normal metabolic function. A vitamin is classified as a coenzyme, which is a chemical other than a protein that's needed by an enzyme to assist in performing metabolic function. Vitamins aren't synthesized in the body in sufficient amounts, and deficiency results from inadequate dietary intake and can lead to serious illnesses. Vitamins are present in many foods and can be supplemented, and they're classified in two different categories of fat-soluble and water-soluble vitamins. Fat-soluble vitamins include vitamin A, vitamin D, vitamin E, and vitamin K. First, we're going to talk about vitamin A. It's a family of compounds called retinoic acids. It exists as two forms, provitamin A, carotenoids, and preformed vitamin A. Vitamin A is used for vision, growth, bone formation, reproduction, immune system function, and skin health. And provitamin A carotenoids are found in leafy green vegetables, sweet potatoes, and carrots. And their preformed vitamin A is found in liver, kidney, egg yolk, and butter. Indications for supplementation. Vitamin A deficiency is used to can treat cataracts, reduction of HIV complications, measles, and malaria. Signs of toxicity of vitamin A include nausea, vomiting, vertigo, blurry vision, hair loss, headache, irritability, skin peeling, bone and liver problems, highly teratogenic, leading to spontaneous abortions and fetal malformations. Teratogenic just means having properties that can disturb the development of an embryo or fetus. Vitamin D is also a fat-soluble vitamin. It's also known as calciferol. It maintains calcium and phosphate levels and plays roles in insulin resistance, obesity, metabolic syndrome, and various cancers. Ergocalciferol is vitamin D2. It is a human-made and it's added to foods. Cholecalciferol is vitamin D3 and it's synthesized in the skin and found in fatty fish, fish liver oil, and egg yolks. Indications for supplementation include treatment of rickets and osteomalacia. Signs of toxicity include high blood calcium levels, kidney stones, nausea, vomiting, thirst, increased urination, muscle weakness, and bone pain. Vitamin E, or tocopherol, is thought to work as an antioxidant. It's found in oils, meat, eggs, green leafy vegetables. Alpha tocopherol is found in olive oil, sunflower oil, and gamma tocopherol is found in soybean oil and corn oil. Indications for supplementation include vitamin E deficiency, macular degeneration, Alzheimer's disease, risk reduction for some cancers and dementia, improvement of immune system function, diabetic retinopathy, cardiovascular disease, and topically it can be used for skin health, healing, and hydration. Signs of toxicity include very high doses associated with bleeding or stroke. Vitamin K is another fat-soluble vitamin. It's a coenzyme for production of blood clotting factors and for bone metabolism. It exists in two forms, phytoquinone and phytonadione. It's found in spinach, broccoli, Brussels sprouts, plant oils, and margarine. And indications for supplementation include vitamin K deficiency or reversal of a warfarin overdose. Signs of toxicity include anemia and jaundice. List the dietary sources of vitamin K. Spinach, broccoli, Brussels sprouts, plant oils, and margarine. So your parents were onto something when they said eat your vegetables. Water-soluble vitamins include the vitamin B family and vitamin C. Vitamin B1 or thiamine is a coenzyme involved in carbohydrate metabolism and plays a role in nerve impulse propagation. It's found in yeast, legumes, pork, rice, and cereals, and its indication for supplementation includes a vitamin B1 deficiency, Wernicke-Korsakoff syndrome, and beriberi. And the Wernicke-Korsakoff syndrome is just it's a complication of drinking too much alcohol. Vitamin B2 or riboflavin is a coenzyme involved in tissue respiration and normal cell metabolism. It's found in cereal, green vegetables, milk, and some meats. It's also made in the intestines by bacteria, and its indication for supplementation include a vitamin B2 deficiency and its use in higher doses to reduce migraine headaches. Vitamin B3 or niacin is essential for reactions that produce ATP and also helps regulate production and activity of cholesterol. It exists in two forms, nicotinic acid and nicotinamide. It's found in yeast, peanuts, peas, beans, whole grain, potatoes, and lean meats. Its indications for supplementation include treatment of dyslipidemia, treatment of deficiency, including medication-related deficiencies. Vitamin B5 or pantothenic acid is a precursor to a coenzyme A, which has a role in synthesis of vitamins A and D, cholesterol, steroids, heme, fatty acids, amino acids, and proteins. It's found in whole grains, potatoes, chicken, beef, egg yolk, liver, kidney, broccoli, milk, and walnuts. It's also made in the colon by bacteria, and its indications for supplementation include a vitamin B5 deficiency. Vitamin B6 or pyridoxine is converted in the body to the coenzymes responsible for amino acid metabolism. It exists as multiple forms including pyridoxine, pyridoxal, and pyridoxamine. Pyridoxine and pyridoxamine are found in vegetables, whole grains, and nuts, and pyridoxal is found in animal foods. Indications for supplementation include a vitamin B6 deficiency. Vitamin B7 or biotin plays a role in many processes including cell replication. It's found in peanuts, green leafy vegetables, liver, egg, yolk, soybeans, and yeast. Its indication for supplementation include vitamin B7 deficiency, which is typically associated with altered absorption. Vitamin B9 or folic acid or folate plays a major role in intracellular metabolism and the breakdown of homocysteine involved in the production of serotonin. It's found in green leafy vegetables, fruits, cereals, grains, and red meat. And indications for supplementation include folic acid deficiency during pregnancy to reduce the risk of birth defects, in end-stage kidney disease to reduce homocysteine levels, and chronic fatigue syndrome, depression, and vitiligo. Vitiligo is a condition in which the skin loses pigment cells, and it can cause discolored patches in different areas of the body, including on your skin and in your hair. Vitamin B12 or cyanocobalamin, coenzyme necessary for cell reproduction, normal growth, and RBC production, is found in fish, milk, bread, and meats. Intrinsic factor produced by the stomach is required for intestinal absorption of oral form, And indications for supplementation of vitamin B12 are the deficiency, pernicious anemia, and end-stage renal disease. The vitamin C is also known as ascorbic acid. Its role in the immune system functions as an antioxidant. Antioxidants are thought to be protective substances that can prevent cell damage caused by free radicals. Vitamin C is readily found in citrus fruits, tomatoes, potatoes, Brussels sprouts, cauliflower, broccoli, strawberries, blueberries, cabbage, and spinach. Its indications for supplementation include vitamin C deficiency, scurvy, macular degeneration, seasonal allergies, improved iron absorption, protein metabolism in premature infants. It's used for prevention in the common cold, cancer, atherosclerosis, and sunburns. So list the water-soluble vitamins. The vitamin B family and vitamin C. So now we're going to talk about fluids, electrolytes, and acid-base balance. This is where I find it gets really interesting, but it's also kind of complicated. This starts in your textbook on page 714 if you want to follow along with the book during the lecture. So there's two different kinds of body fluids. There's intracellular fluids and extracellular fluids. Intracellular are found inside the cells and extracellular are found outside the cells. The human body consists of 40% to 70% water depending on weight, sex, and age. There's different things that can cause water deficiency, including vomiting, diarrhea, edema, excessive sweating from fever, large urine output, and acute weight loss. The signs of water deficiencies would include dry skin and mucous membranes, wrinkling of the tongue, hypotension, tachycardia, and lowered body temperature. So if you work in a hospital, or even if you work in some specialty retail pharmacies, you'll come into contact with IV fluids. IV fluids are used to replace fluids and electrolytes lost through dehydration and for administering drug therapy. Tonicity is the concentration of a solute in a solvent and how that concentration affects movement of water across membranes. It refers only to molecules that do not move easily across membranes. And page 715 in your textbook, it talks more about tonicity. Osmolarity is the concentration of all molecules in a set volume of fluid. It refers to molecules that do and do not move across membranes. Osmolarity is measured in milliosmoles per liter. And as an example, the osmolarity of blood plasma is 275 to 300 milliosmoles per liter. Isotonic solutions have a concentration of solute similar to plasma, and the amount of water entering and leaving cells is the same. Hypertonic solutions contain a higher concentration of solute than bodily fluids, and the cells in these solutions shrivel as water leaves the cell. Hypotonic solutions contain a lower concentration of solute than bodily fluids, and cells in this solution burst as water rushes into the cell. This diagram is also found on page 716 in your textbook. Up here on the right, in the animal cells, they give you a description of what the different types of fluids do. So like the isotonic conditions, you have your plasma membrane and everything is balanced so that cell looks normal. The hypertonic conditions, as water rushes in, the cells shrivel, and hypotonic, the cells burst as water rushes in. Crystalloids contain electrolytes. They're used to replace lost fluid and treat dehydration. This include normal saline and dextrose and water. Colloids contain proteins and other large molecules, and they act similarly to hypertonic solutions. They increase osmolarity of plasma, which pulls fluid from interstitial spaces. These include albumin, dextrin, and blood. Some cautions and considerations. Hypertonic solutions can be irritating to tissues and blood vessels, and they must be administered via a central line or IV. Sterile water for injection should never be administered by itself. It causes red blood cells to burst as water rushes from plasma into red blood cells, and it leads to destruction of blood and release of intracellular material in mass amounts. So, different examples of hypotonic solutions. The solution would be a half normal saline or 0.45% sodium chloride. Normal saline is classified as 0.9% sodium chloride. And then dextrose 2.5% in sterile water. Isotonic solutions would be dextrose 2.5% in half normal saline, dextrose 5% in sterile water, normal saline, and lactated ringers. And hypertonic solution includes dextrose 5 in half normal saline, dextrose 5 in normal saline, dextrose 10 in sterile water, and then the different concentrations there of the sodium chloride. What is a solution that has a similar concentration to blood plasma called? Isotonic. So electrolytes are molecular compounds that form ions when dissolved in water. They exist in the body as positively or negatively charged ions, and cations are positively charged ions such as sodium. Anions are negatively charged ions such as chloride. They're measured in milliequivalents, or MEQ, per liter, and they're present in both intracellular and extracellular fluid. Osmosis is the passive movement of water across cell membranes to maintain equal concentration of molecules on both sides. So some common electrolytes that are found and have to be replenished in the body include sodium, potassium, calcium. This chart also gives a description on where these are found and what role they play in the body. Magnesium, chloride, and phosphate. And then electrolyte replacement can include oral potassium, IV potassium, oral calcium, oral magnesium, IV magnesium, and phosphorus. One thing to consider and be cautious about is most electrolyte products are not to be used in kidney failure or impairment, and they must closely be monitored if they're used in these cases. Injectable potassium must be diluted and mixed well before administration. It must be given slowly, and the maximum safe concentration is 80 milliequivalents per liter. Black tops on vials of potassium products. You'll find this if you do work in a hospital. There are warnings on different medications and electrolyte solutions that you need to take extra caution on. One is on the potassium vials, and they'll say things like must be diluted before administration. And then, as this points out, they all have black vials. Calcium and phosphate both have a potential for chelation, and if they're mixed in the same bag. Acidosis occurs when the extracellular fluid contains excess hydrogen ions, which causes the pH to drop below the normal range. There's different types of acidosis. We have metabolic acidosis and respiratory acidosis. Metabolic acidosis occurs when excess acid is produced, bicarbonate is lost, or the kidneys do not excrete enough acid. Respiratory acidosis results from slow breathing and retention of carbon dioxide in the blood. Alkalosis occurs when there is a loss of hydrogen ions, producing an increase in bicarbonate, which increases blood pH. Metabolic alkalosis occurs when excess acid is excreted by the kidneys or lost from the stomach. Respiratory alkalosis results from rapid breathing. More carbon dioxide is exhaled and eliminated from the blood. Acid-base balances are very important. Acidifying and alkalinizing agents include ammonium chloride. Ammonium chloride is an acidic substance used to treat hypochloremia and metabolic alkalosis. It prompts the kidneys to use ammonium instead of sodium in excretion, resulting in reduced availability of sodium for making sodium bicarbonate, and it is given as an intravenous infusion. Acidifying and alkalinizing agents also include sodium bicarbonate. It's a basic substance used as an antacid, a systemic alkalinizer for treatment of metabolic acidosis, and a urinary alkalinizer when treating hemolytic emergencies and drug overdoses. It's available as tablets, oral powder, and IV form. An interesting fact is sodium bicarbonate is also just plain baking soda. It's sometimes used to correct acid-base imbalances, and it can be found in the pharmacy and at the grocery store. When combined with moisture and an acidic ingredient in baking, sodium bicarbonate produces bubbles of carbon dioxide, and this is what helps baked goods to rise and become light and fluffy. What is the difference between acidosis and alkalosis? There's a couple differences. The pH in acidosis is below the normal range, and the pH of alkalosis is above the normal range. In acidosis, the plasma contains excess hydrogen, and in alkalosis, the plasma contains excess bicarbonate. Obesity is a condition characterized by excessive accumulation and storage of fat in the body, and an increased rate of obesity over the past few decades has occurred. You'll notice as income stay the same, but cost of living goes up, you have less income to devote towards nutritious meals and healthy fruits and vegetables. And the lower your income, a lot of times the more prone you are to obesity because you're eating lower priced, less nutritious foods. Causes of obesity include environmental factors such as a sedentary lifestyle, readily available food supply, increased intake of fats and refined sugars, and decreased intake of fruits and vegetables. There's also genetic correlation to take into account, which includes obesity among first-degree relatives as predictive of obesity in adulthood. Physiologic factors include a decreased release and sensitivity to hormones signaling satiety as fat tissue accumulates, medical conditions, and medications. There are some lifestyle interventions to tackle obesity, including reduced caloric intake. Restrictive diets are not often sustainable, and it's important to maintain proper nutritional balances. But increased caloric expenditure usually proves to be a longer and healthier alternative. Bariatric surgery is also an option, and that it's a restrictive procedure and malabsorptive techniques. There's different medications that can treat obesity. One group is called lipase inhibitors. Orlistat is now available over the counter as Ally or Xenical. What it does is it binds to gastric and pancreatic lipase in the intestines, preventing it from breaking down fats into an absorbable form. Fat then passes through the intestines and is excreted in stool. The bad part about that is that you have fatty and oily stools, and a lot of times it causes fecal incontinence. So it's not always the best alternative. Another classification is sympathomimetic drugs. These are controlled substances. The most common there on the bottom is the phentermine, you've probably heard of, Adipex P. It stimulates dopamine and norepinephrine and prevents reuptake of serotonin, which causes increased neurotransmitter levels and which signals a sense of satiety. There's different side effects including headache, stomachache, insomnia, nervousness, tachycardia, irritability, dry mouth, difficulty urinating, constipation, and impotence. Pharmacologic antagonists. I think this slide is out of place. This is talking about poisons and antidotes. We'll go over those really quick though. Antidotes includes acetylcysteine, amyl nitrate, atropine, dapsone. These are, the antidotes are on the left and the chemical that it reverses is on the right. We'll get more into the poisons and their antidotes after we're done discussing obesity. You also have serotonin agonists, which include Belviq. The way it works is it activates serotonin receptors and thereby reducing appetite and food intake. Side effects include headache, upper respiratory infection, back pain, dizziness, and nausea. Glucagon-like peptide receptor agonists include Saxenda. It stimulates glucose-dependent insulin secretion and inhibits glucagon release and gastric emptying. It regulates appetite and caloric intake. Side effects include nausea, hypoglycemia, diarrhea, constipation, vomiting, headache, decreased appetite, dyspepsia, fatigue, dizziness, abdominal pain, and increased lipase activity. Form of malnutrition. One thing that you can do as enteral nutrition is an option if you are malnourished. Enteral nutrition includes a method of feeding a patient liquid nutrients through a tube inserted into the GI tract. It may be given as a bolus dose or continuously. Its indications include bowel obstruction, short bowel syndrome, Crohn's disease, and inability to swallow foods. Enteral nutrition must never be administered through an IV line, and it is preferred to parenteral feeding. Here's a diagram. This diagram is also found in your textbook, but it shows the different placements of the NG tube, the G tube, and the J tube. Let's see if I can find that page really quick. It's on page 732 in your textbook, and it goes more into depth about the different types of enteral feeding. There's a chart on page 732. Parenteral nutrition is a method of feeding a patient through an IV line. It's referred to as total parenteral nutrition, or TPN. Its indications include severe burns, intolerance to enteral feeding, anorexia nervosa, pancreatitis, severe gallbladder disease, inflammatory bowel disease, and severe diarrhea. Regular laboratory monitoring required to guide therapy and prevent infection. Parenteral nutrition is also known as PN, and there's some complications of acid-base balances, dehydration, elevated serum triglycerides, failure to induce anabolism, high serum lipid concentrations, hyperammonemia, hyperglycemia, hypoglycemia, hypoalbuminemia, imbalance of electrolytes, and liver toxicity. Total nutrient admixture, or TNA, is a 3-in-1 and contains lipids, amino acids, and dextrose. 2-in-1 contains amino acids and dextrose. Order of adding nutrients minimizes precipitation. Calcium and phosphate cause the most problems with precipitation. Specific salts of calcium and magnesium are important, and multivitamins should be added last due to the potential of degradation. So now we're going to talk about poisons and antidotes. The population with the highest risk for consuming poisons are children, older persons, and occupational exposure. There are concerns regarding ingestion, including elimination of the poison from the GI tract to prevent its absorption and diminishing the effects of the absorbed dose. Decontamination is defined as removing as much of the ingested poison as possible. Different strategies for decontamination include emptying the stomach, preventing absorption, and inducing vomiting. Here's some examples of chemicals or poisons and then their antidotes. Antivenins are defined as a material used to treat poisoning by animal venom. Snake antivenins may require a high dose. Serum sickness is a common side effect, effective against all pit vipers, and they need to have epinephrine, IV antihistamine, and hydrocortisone available when administering. One example of a snake antivenin is called Crofab. It's used most often in emergency room departments, such as the one at UK, and it covers all different types of North American crotolid bites. Spider bites, black widows, supportive care effective for most healthy adults, antivenom indicated for patients younger than 12 years old and patients older than 65 with certain medical problems. A brown recluse dapsone is used to preserve the skin around the bite. Scorpion stings are given an antivenom called Anascorp. A code blue is initiated when a patient is in a life-threatening situation, such as when a patient's heart has stopped beating or breathing has ceased. Emergency carts must be checked regularly by the pharmacist. When a cart has been returned to the pharmacy, the drugs must be restocked. The technician must remove and replace any expired drugs, and generally any that will expire in the next 1 to 2 months, or whatever the hospital's protocols mandate. Here's some drugs that are used in crash carts and their indications. The majority of them are listed here in this chart. What steps should be followed when an emergency cart is returned to a pharmacy? The drugs used in the code blue should be restocked. Any expired drugs should be removed and replaced. Bioterrorism is defined as an attack or threatened attack by terrorists whereby the weapons are biologic agents and emerging infectious diseases. Types of agents include disease-causing microorganisms, which would grow in the environment or in a living host, or toxins, which are the product of living organisms and do not reproduce. Some different bioterrorism diseases listed here. The role of the pharmacy technician for bioterrorism, we are on the front line of defense in dispensing medications, maintaining patient profiles, and documenting patient allergies. Probiotics are live organisms ingested to maintain or restore normal bacteria in the body. They're used for irritable bowel syndrome, diarrhea, eczema, vaginal infections, and allergies. They should not be used in patients with compromised immune systems. Side effects include upset stomach and burping. And products include Acidophilus, Activia, Align, Culturelle, Flora-Q, and Lactonex. All right, that's the end of the chapter. If you all have any questions, let me know.